Hello friends, in this video I am going to discuss about frontotemporal lobe dementia. So from the name itself we can understand that there is predominantly frontal and temporal lobe involvement. So if these patients have predominant frontal lobe involvement, they will have behavioral and personality abnormalities because frontal lobe is associated with the personality and the behavior. So if they have predominant frontal lobe involvement, they will have both personality and behavioral disturbances, and that variant is known as the behavioral variant. But if these patients have predominant temporal lobe involvement, they will have FSAS. Okay, and that variant is known as primary progressive aphasia. Okay, so these are two important variants of frontotemporal lobe dementia. All of them will have both frontal and temporal lobe involvement. But if they have predominant frontal lobe involvement, that group is known as the behavioral variant group. And if they have predominant temporal lobe involvement, that group is known as primary progressive aphasia. They will have aphasias. There are two types of inclusions we get in frontotemporal lobe dementias: tau inclusions and TDP43 inclusions. As I have told you in the lecture on Alzheimer's disease, that tau inclusions are not specific for Alzheimer's disease. They can be found in various other neurodegenerative conditions. So tau inclusions are also seen in frontotemporal lobe dementia. In this image, this is an image with tau immunohistochemistry, and you can see there are many neurites. These are all dystrophic neurites which are containing hyperphosphorated tau aggregates. Okay, and this is a neurofibrillary tangle. This is a neurofibrillary tangle. Neurofibrillary tangle is hyperphosphorated tau related filaments within the neurons. Okay, usually neurofibrillary tangles are flame shaped or elongated, as you can see in this image, but sometimes they can be globular. As you can see in this image. There is a variant of frontotemporal lobe dementia that is known as Pick disease. It is characterized by asymmetric atrophy of frontal and temporal lobes. It is characterized by asymmetric atrophy. Second point is they will always spare the posterior 2/3 of the superior temporal gyrus. So they spare posterior 2/3 of superior temporal gyrus. The next point is there will be severe atrophy of the gyrus, and this is known as wafer thin or knife edge gyrus. That means there will be severe atrophy of gyrus. Okay, severe atrophy of the gyrus, and you will get the characteristic peak bodies. Peak bodies are nothing but the rounded or the globular tau inclusions. Rounded or globular tau inclusions, those are described in Pick disease, and they stain intensely with silver stain. Okay, so they stain intensely with silver stain. They'll stain black in silver stain like Belchow's crystal. So these are the important points about Pick disease. So Pick disease is a variant of frontotemporal lobe dementia where we are getting asymmetrical atrophy of the frontotemporal lobes. It will spare the posterior 2/3 of the superior temporal gyrus. There will be significant atrophy and thinning of the gyrus, and you will get the peak bodies. These are nothing but the rounded globular tau inclusions which stain intensely with silver stain. So that's all about the frontotemporal lobe dementia.